It's the art of dentistry. Dr. Robin Rutherford.
Welcome back. Gum disease. What is it and how can you treat it? In today's Art of Dentistry, Dr. Robin Rutherford is here to explain just that. Dr. Rutherford, thanks so much for being with us.
I'm glad to be here.
Okay, so first explain to us, what is gum disease?
Gum disease is an infection. Okay, like you had an infection anywhere else in your body. Gum disease is, however, not just something that you would treat with antibiotics and it goes away, because the source of the problem is the plaque, the tartar we call it, or calculus, different names, that actually hardens onto your teeth, and that's what you have your teeth cleaned at your hygienist to get off. But gums are infected, and so they bleed, and maybe your breath is not as good as it should be, things like that.
Okay, and so I guess what the signs and symptoms are the bleeding and the bad breath? Okay.
Yeah, I wanted to say that today I want to talk about two misconceptions that people have about gum disease and one big lie. Two misconceptions and one big lie.
Okay.
The first misconception is that, well, my gums always bleed a little bit when I brush. Isn't that normal? No.
No, it's not.
You know, if you take a bath, your arm doesn't just bleed when you use your washcloth, you know.
That wouldn't be good.
If you did, you know, you would say something is not right here.
Right.
But people think, well, my gums always bleed. That's normal. It may be normal for you. It's not normal. It may be what always happens, but it means your gums are not healthy.
Okay.
And so you need to go to the dentist.
Okay.
So no bleeding at all is healthy.
Okay.
If your gums ever bleed, no matter what, then you should go to the dentist.
Okay, and to prevent that bleeding, obviously good brushing habits and flossing as well?
Yes. First of all, you want to keep the plaque, which is just the layer of germs, bacteria that kind of forms on your teeth all the time. You want to keep it off. And so when you brush, when you floss, that's cleaning it off, and so it's not there to harden on. But if you don't clean it thoroughly enough, it begins to harden on. And then when it hardens on, it will not just come off. Okay, and that's my second big misconception, is that if you have tartar, calculus on your teeth, well, brush harder, you know, brush harder and brush more. Well, no, now you're just brushing the tartar, because it will not come off to just what you can do or what I can do on myself.
Okay.
You have to have your teeth professionally cleaned by a hygienist.
Okay, so that's a big step. You should be getting this done twice a year at least, right?
Well, yeah, at least. Now, if you have a healthy mouth and a preventive type of cleaning where you don't have any big problems, yeah, twice a year is probably right. But if you actually have gum disease and we're trying to heal your gums and bring them back from being in bad shape, it might be every 3 months, every 4 months, 3 or 4 times a year.
Okay.
Now, this leads me to my big lie.
Yes.
Bad breath. If you have bad breath, it means you have probably gum disease going on. It does not do anything at all to swish with Listerine or any other mouthwash.
Oh my goodness.
These companies that make the mouth rinses, the mouthwashes, make millions and maybe billions of dollars every year selling you mouthwash and telling you it will make your breath minty fresh. Well, it will for about a minute, because the reason your mouth smells bad is because you have an infection.
Wow.
And nothing is going to change that until you are no longer infected.
Yeah.
So forget the mouthwash. Go to the dentist. If you think your breath is not as good, or your spouse is telling you your breath is not as good, it's because you have gum disease.
Okay.
So these are all misconceptions and lies, you know, but that now you know better.
So don't waste your money on that mouthwash.
Yeah, don't even do it. What you need to do is to go to the dentist.
Okay,
Yeah.
perfect. Okay, let's talk about these pictures you have here.
Okay. This first photo is a typical photo of what tartar looks like.
Okay.
This is somebody's lower front teeth from your tongue's point of view, looking forward.
Okay.
And so from the outside, it may not look so bad, but from the inside, that's usually where it's the heaviest. But you can see the tartar is kind of yellow-brown, and how the gums are so dark and red along the edges.
Right.
Because they're irritated, they're beginning of being infected. This next photo is a little more extreme example, and I've showed this before, but this is a patient that came to me a few weeks ago, and you know, his gums are not good. He has a lot of tartar on his teeth, and we are in the process of sort of cleaning his mouth up.
Okay.
You know, taking off all the tartar, and his gums are actually healing. And in a little while, in a few more weeks maybe, we're going to have some after photos to go with the before, and it'll be a really neat before and after difference of what we can do to get your gums healthier.
Yes, and this is an extreme case, you said. Okay.
Well, it's not the only time I've seen it, though.
Right, right. You know, this happens.
Unfortunately, yeah.
Okay. Well, Dr. Rutherford, thank you so much for coming today.
I always enjoy it.
It's the art of dentistry. Dr. Robin